Thank you, Mr. Chairman, Ranking Member. It is absolutely clear that we have a problem with drug prices when price increases accounted for 100% of the pharmaceutical industry's $8.7 billion bump in earnings last year. But I fear that it's about to get even worse with the very partisan health care bill that's about to be brought to the Senate floor, which I believe will make many, many, many Americans pay a lot more for less care. But I'm glad this is a bipartisan hearing. We should be working on bipartisan solutions to improve costs instead of pulling the rug out from under so many of our constituents, like my Wisconsin constituents, who are already struggling to pay for life-saving medications. Wisconsinites like Diane. Diane is from Webster, Wisconsin. She recently had to stop taking her multiple sclerosis medication that costs more than $90,000 annually today. She's seen the price increase over the last 23 years, and she has seen her savings be just completely drained. And it's why I had the opportunity to introduce the excuse me, Fair Drug Pricing Act with my colleague, Senator John McCain, to require basic transparency and accountability, like research and development costs, like marketing and advertising spending for drug companies that choose to increase the price of certain drugs by more than 10% a year. Holding drug companies accountable is a first step to addressing these dramatic price hikes that are making health care more and more unaffordable for too many families in Wisconsin. Now, I believe that the market is broken when people like Diane have to make that sort of decision, and we continue to see these yearly price increases. Pfizer has already raised the price of 90 of its existing drugs by about 20% this year. While drug companies often argue that their price hikes are due to product improvements and new R&D, we have absolutely no way to verify this. What could we do to limit these price increases for existing drugs? And do we need more information surrounding drug company pricing decisions to help improve access? And I want to start in answering that question with you, Mr. Kuchel.
Thank you, Senator. You started with multiple sclerosis, and it's an interesting area where there are a dozen drugs or so, and every time a new one comes along, the price of all the old ones goes up. So that shows us that the market is not working the way markets are supposed to be working. It's absolutely a difficult area to make policy in because there is such a lack of transparency about who's paying what. It's very, very complex. I think the question of whether R&D costs have a direct relationship to price is an important one, and clearly it's an expensive undertaking to develop a drug. But if two virtually identical drugs came to market with really different R&D costs, we wouldn't expect them to have a different price. And so really, as the consumer, what I want to buy is a clinical outcome, and it doesn't matter to me that much what the R&D cost is.
Thank you.
Senator Baldwin?
I have a separate question for you, Dr. Anderson. Since 2002, 3 major drug companies have increased the price of insulin by more than 200%. I heard from a constituent, his name is Greg from Stoddard, Wisconsin, who has 2 sons and is struggling to afford the costs of their diabetes and insulin treatment that costs more than $1,000 a month. I want to know if the drug maker that increases their price every year considers Greg's son or any of the other families who depend on their drugs to function. Dr. Anderson, can you discuss why companies who make life-saving drugs are incentivized to regularly increase their price or launch new drugs at radically high prices? And how much does the impact of these high prices on real patients factor into any of their decisions?
So I had the opportunity to go to meet with the investment bankers and the drug companies and ask pretty much that same question. And the simple answer is because they can. Essentially, there is no regulation, and because they have a monopoly, they can set the price at whatever they want to set it. So they essentially have that ability. And what they've seen from people like Martin Shkreli, who have done it and gotten away with it, that they should be able to do it. So the investment bankers are often telling them, you should do the same thing as Martin Shkreli did.